welcome to everyone and thank you for joining us this evening on this webinar, Questions and Answers Delta Variant. Now, today's event has been organised by Black Country Near Neighbours and Black Country NHS Equality and Diversity Team. For those, a lot of familiar names there, which is always great to say, but there's also some unfamiliar names there, so welcome to you all. So for those who don't know me, my name is Shaz. I'm from Transforming Communities Together and I head up the Near Neighbours programme across the Black Country. Now, this webinar will be co-chaired by myself and Mohammed Yasin. Yasin, I'd like to give this opportunity to introduce yourself, if that's okay.
Thank you, Shaz. Good evening, everyone. So my name is Mohammed Yasin. I'm a community development worker for the Black Country Healthcare NHS Trust. So on behalf of the Black Country Healthcare Trust and the Equalities and Diversity team, which is led by Yasin Mohammed, who's the EDI lead, I would like to welcome you all to this webinar. Just like some of our previous webinars, I do hope that we are able to provide some insight into the Delta variant through our professional speaker, Dr. Masood, who is also joining us. And so due to the emergence of this new variant, we had a number of requests to put something together to highlight the importance of this variant and also to provide an opportunity for people to ask any questions that they may have. And I also want to highlight as well, I've had a notification from Dr. Masood, being the Chief Medical Officer, he's had an emergency to attend to at 6:15, so he will be leaving for 10 to 15 minutes and will join us again. Is that right, Dr. Masood?
Thank you for that, and thank you for the invite. I found that certainly from a commissioner's perspective, a CCG perspective, in my role, we are responsible for the population of Black Country in West Birmingham. And actually one of the challenges we face is that, this is all new territory. The way in which the pandemic has evolved over the last sort of 18 months or so, the impact it's had, we're still learning so much. And so actually opportunities such as this with Near Neighbours and Transforming Communities, where we can actually hear from our communities about some of the real challenges faced, are really helpful. But what I'd like to do is really just frame things for you in terms of that journey and in terms of our experience. As a CCG, we've been responsible for the vaccination program. So we are, on a regular basis, looking at the figures as they come in, the infection rates and how it's spreading, but also understanding the impact on primary care and appointments, but also the impact on hospitals. And so, in January and February, we were in a really difficult position where we had the second wave and we had the first peak of the second wave, but then actually we had a second peak of the second wave, which was significant. And coping with that in terms of our capacity was really difficult. Now, one of the biggest challenges we faced is that the things that you can see are a lot easier to understand and deal with. And so when people have a cough, when people have a fever, when people have weakness and that, you can see the impact, it's a lot easier for us as clinicians and for the healthcare services to engage and understand and respond. But actually what hasn't necessarily always been appreciated is the undercurrents of the impact of the pandemic. And especially, as you've mentioned it, from a mental health perspective, there are so many different aspects. So there are those that have suffered directly because they've had the illness and then they've had slow recovery and long COVID. There's that aspect. Then there's the impact on family and friends, where many of us will either have lost loved ones or will know of people that have been lost. Then there are all the social constructs and the impact of that, how we interact as a society, how we've had to change, and with social distancing, with the lack of kind of touching in a normal social sense, shaking hands, those kind of things. It's really had an impact on many of us, but also recognizing the impact on people in their work environments and in their school environments. Children who have had to be at home in very difficult circumstances in terms of isolation, in terms of interaction. And not everyone has had accessibility to others. So, things that some of us may take for granted in terms of, having broadband and having technology so that we can in some way keep connected. Many of us haven't had that accessibility. And so there's a huge spectrum of, if you like, manifestation of how the pandemic has affected us. And I think, you know, there is a hope, if you like, because from December onwards, last year, we have had the vaccination program. And I think in that respect, we've made a lot of progress. I mean, what's really encouraging is that, you know, we've delivered, I think, 1.4 million vaccines across the Black Country in West Birmingham. And of that, over 800,000 have had their first dose, and another, you know, 600,000 have had both doses. And that, I think, has really had an impact in terms of reducing hospital admissions. But then when you just think that you're making progress and things are returning to normal, we've then had another variant that's emerged, and the Delta variant. And, you know, just when you think things are starting to return to normal, well, unfortunately, we're seeing the Delta variant start to increase in terms of the rates. At the moment, you know, if I was to look at the whole area as a whole, we're looking at about 300 per 100,000 cases. And that's equivalent to where we were in January this year. So we are on a significant upward trend. What does that mean in terms of, you know, Freedom Day and, you know, the lifting of restrictions? It's very difficult to tell. And I think one of the things that I would say is that, you know, when we take into account all the impacts that we've discussed, that, you know, moving to Freedom Day, it doesn't mean we ignore everything that's happened. And actually, I would really recommend caution. And so I think there are so many aspects, and I know that every time I've joined one of these webinars, new questions have been asked, we've been challenged, we've shared, and we've learned. So I'm hoping that we'll get the opportunity again, and it's good to see some familiar faces who actually also are very much are engaged with our communities and really see the impact, you know, on the front line. And so I've been very lucky to connect with a number of the people on this call to understand how that's happening so that we can actually be prepared for the next phases. Shaz, I'm going to stop there. I do apologize. I am going to have to drop off in a couple of minutes because there are certain calls that I can't get out of. And so while this has been in my diary for, you know, a number of weeks, I do apologize. If it was something that I could have avoided, I would have done. But I will drop off in a couple of minutes. I hope that gives you an idea in terms of the journey so far. But what I'd like to do is I'll drop off the call, but then when I join, Shaz, if there are any questions that I can answer, I think that's really where I have an opportunity to share, and I can go into a bit more detail about the Delta variant, which is the one that is of concern at the moment.
What we will do is we will go to our participants and ask them their contributions and their opinions on what Dr. Masood has just said. We've already got some questions coming in, but like Dr. Masood said, when he comes back, he is more than happy to answer those questions. But we're just going to go into a discussion just to hear your experiences, whether you've had the vaccine, that would be a good one as well, how these unprecedented times has affected your mental health, if it has. Because I know for myself, if I was to tell you my journey, before the pandemic, I was actually quite a healthy person mentally. But during the unprecedented times, it's been difficult, really difficult, actually. I've had a lot of loved ones that have passed away. Some have caught COVID, other due to other reasons. And the grieving process has been really different and really isolating, really, because there was nobody there to hug me. There was nobody there to say, it's okay, we're here to support you. So all that had an impact on my mental health. And I even suffered from anxiety during the unprecedented times because there was so much going on and I just couldn't get that support that I needed. So I'd love to hear how you have gone through these unprecedented times. I mean, Yasin, would you like to share a bit of your journey? How have you coped during these unprecedented times?
Looking back, say 12 months ago, you know, where we were, it's difficult to kind of put it into words as to, you know, your feelings as to what you're going through, the emotions you're going through as well, mentally as well as physically as well. But then I think it's you know, life has changed so much over the last 12 months. that it is unbelievable as to where we are and how, and everybody kind of goes through this journey individually. During the last 12 months or so, I've had 2 deaths in my family, not immediate family, but obviously within the family as well, because of COVID as well. And I think one of the biggest things is the actual grieving process within certain community, and especially some of the South Asian communities as well. And as you know, the grieving process is a lot where communities come together, families get together, and they actually grieve. And I think that is what is lacking as well. And the mental impact that has on you as an individual, and also those close around you as well, is even more immense as well, that you're not able to even grieve. You're not able to go and see someone. You're not even able to go and see, receive people either. So it does kind of have a mental impact on you as well, on a day-to-day life as well. And I think the other thing as well is, especially if you've got children as well, children around you as well, the impact then obviously which is on them is even far worse as well. Especially like, we've seen over the past few months as well, where even the schools have been shut as well, and where they've had to kind of isolate most of the time, spend most of their time in the house. Children need their own space. They need to be out. They need to be with their friends in open spaces as well. So it's difficult to try and kind of entertain them in the house, as well as maintaining your own well-being as well. So it's not easy. Whereas previously you would have had the support of, say, family members as well. And now you're kind of having to manage yourself, and then you're having to manage your work, and as well as your children as well. So it's not easy. And I think it has a big detrimental impact on your health and mental well-being. But I think under the circumstances, we can only hope that, we've gone past that point as well. Hopefully we can hope and pray that going forward, things will only get better now. And we can all come out of this eventually at some point, and kind of be fully reunited with our friends, families, and freely be able to go and visit and see each other. But as I think the concerning thing for me, and I'm sure for other people as well, and people who've already highlighted, is like Dr. Masood mentioned, this new the variant, the Delta variant. We really don't know where this is going to take us. It's an unknown territory. We've never been here before. And the way it's emerging and mutating into other variants as well, which I'm sure Dr. Masood will talk about later on as well. So it's really difficult to know as to where this journey is going to end. But I think the best thing we can do is to try and keep ourselves safe as possible, keep our loved ones safe, and whenever possible, take the opportunity to get yourself vaccinated. That is, I think that's my message as well, to protect yourself and also the people around you as well. Use the opportunities. There's so many different facilities that are being provided for different communities as well to come forward and have the vaccine, take the vaccine as well. And that is the only way that we are going to come out on the other end. So I'll leave it there for now as well. So I'll hand it back to Shaz and see if anybody else wants to come in and share their journey.
That was a really good reflection, Yasin, of your journey during the unprecedented times. Now, Dr. Masood has joined us again.
If it's all right, I'll just pick up a couple of points about the new Delta variant, because I think, again, we don't always appreciate the difference between what we originally had in terms of COVID and where we are now. So with original COVID, it would spread to 1 or 2 people. And then we had the Alpha variant, which was known originally as the Kent variant. And that had 50% higher infection rate. With the Delta variant, that's another 50% higher variation in terms of the infection rate. So we really have gone from a virus that was spreading quite easily initially, and then the mutations are spreading even more. And that's part of the reason why we've seen a surge in cases. Now, thankfully, the best protection we can have is by getting vaccinated. So at the moment, we're not seeing a huge increase in hospital numbers, but that doesn't mean you're completely safe. And I think that's the point that sometimes, especially our younger population, They feel that perhaps they don't need the vaccine because they're young, they're fit. If they get it, they might get mild symptoms, but actually long COVID has a significant impact, and we're still learning about that, but also the impact on mental health.
Our first question for you, Dr. Masood, was from Corey, who says, what are the pros and cons of the vaccine?
So I think the biggest pro of the vaccine is that it will protect you. If I'm to be blunt, it'll hopefully stop you from dying. I mean, that's the biggest factor, is that prior to vaccination, those that were vulnerable because of other health problems, including mental health, those that had that were from a BME background, diverse background, they were more susceptible, and therefore there were a significant number of deaths from COVID. I think that's the biggest pro, that's the biggest plus. But not only that, if you're vaccinated, you're not just protecting yourself, you're protecting those around you. And so initially we weren't sure if there was a protective element. Actually, the evidence is that it does help. Thankfully, the evidence that's coming out is that there is protection at the moment against the Delta variant. So at the moment, the vast majority of infections we're seeing are now the Delta variant. So that is the dominant strain. That's the one that's spreading. Because it spreads so fast, that's the one we have to be wary of. Unfortunately, we do have the Delta Plus variant that is starting to emerge. At the moment, we don't have enough information about that. But in terms of the biggest pro is that actually it will protect you from getting from dying. It will protect others, so spreading the disease, but also it will minimize the symptoms. So in terms of long COVID, it will have an impact in that. In terms of the cons, I think it's important to recognize that there are some risks, but those risks are very low. And we have seen some of those. So we've seen it in the under 40s when it comes to blood clots. And therefore we've had to change our advice. Now, when we talk about, the risks, we also have to put it into context. So in terms of clots for the under 40s, we're talking about one death, potentially one death in a couple of 100,000, which is a lot lower than those people that die from car accidents, that people that die from COVID. So I'm not saying that it's not going to happen, but the risks are very low. And when we look at it on balance, often we work on that idea of risk. So while there are some cons, I think they are few. And if you look at the benefits, they far outweigh the cons.
That's great, Dr. Masood. I think that was answered really well. So thank you very much for that.
My kids have asked to self-isolate during 10 days. Does it mean that children are also contaminated by COVID-19 or this Delta variant?
Yeah, so again, when you think about it, the more people get vaccinated, the more they're protected, which means that actually the pockets of infection that do spread, they start to spread in people that are unvaccinated. Because if you like, when you think about the virus, it hops from one person to another to another. And so we're seeing it more now in schools where it's still not that many. So I certainly wouldn't say that it is a concern, but I think it needs to be recognized. And I think that's why the debate at the moment is, come 19th of July, what do we do in our schools? What do we do in our hospitals, our businesses, in our GP practices? Do we continue with masks? Do we continue with social distancing? And I think it's a difficult one, but certainly I would err on the side of caution, because I would say that, as Mohammed said, this is a new variant, and actually, again, we're going into new territory. And you can hope for the best, but actually it's better to be safe. In terms of the impact on young people and children, the impact is far less, which doesn't mean it's impossible, but generally we're finding that with children, there is less impact in terms of the symptoms, in terms of recovery. But I think as we move forward, we do need to look at what is our strategy going to be. Certainly in the US, they've started to give the Pfizer vaccine to people who are, over the age of 12. And I suspect we are going to move to a similar model. Our focus is still on the most vulnerable and ensuring that they have vaccines. But I think we will move to a model where we'll actually start to go down to the lower age groups, because in the end, what we want to do is block all the opportunities for the virus to spread. And that means we also need to start going down to the sort of children as well.
That's great. Thank you for that, Dr. Masood. I would like to bring Maria in. She's got her hand raised.
We are working with the GPs to ensure that the young carers are able to get the vaccination, which they are under the JCVI, 16 and 17-year-olds. We seem to be coming up against a lot of GPs who are not willing to do this. Do you have any advice for us to ensure that our young carers are able to access this vaccine?
So it's a difficult one because the advice changes very quickly. And actually, as you've said, if you've got carers can get the vaccine and should be able to. So one of the options is to go on the national booking system.
We've tried that, it doesn't work.
Does it not allow it?
Because they're under 18.
I think one of the things I would say is that every vaccination site will have a clinical lead, and they are the coordinator. And if you find that they're saying no, then what you do is raise it with them and say, can you please check with the up-to-date guidance? And I think, I'm going to have a word with our comms team and say, look, this has been raised at a webinar. Can we get some comms out to all our GPs to let them know what's the process for carers? So I'll follow it up from my side. But really, I think what I would say is that sometimes the information, it does take a little bit of time to be updated, because so many people are doing so many things. And I can only apologize that sometimes when people haven't seen the latest information, they may not know what it is. But I will take that away.
Yasin, do you want to come in at this point?
No, I just want to say, basically, we have got a few questions coming in through the chat, and I've got two questions which have come in through the email as well. So hopefully, just bear with us. As soon as Dr. Masood joins us, we will try and get all the answers, all the questions answered for you. So in the meantime,
myself, can I just share something with everybody, Mohammed?
Yeah.
Myself, I had the vaccine. I think Maria was talking about somebody under 18 being a carer. I was a registered carer for my mother and my mother-in-law, and I was able to have the vaccine very early on, but I contacted my doctor's surgery, and it was on their system that I was looking after my mother in a daily basis, and I was allowed to have the vaccine, but I'm not under 18, so I don't know if the rules are different for that age group. But that was a great question. I would love to hear whether others here have had the vaccination, why they haven't, and if they have, why they did. I mean, Yasin, you had yours, didn't you? What made you have yours?
I had mine, but I think I had my first one back early December, around December, but that time first one. And I really wanted the vaccine because I just wanted to be protected more than anything else. Yeah. Even though there was a lot of information around at that time around hesitancy and so much misinformation going around, but I made my own decision, and it was my own personal decision, really. I wanted the vaccine. And, whereas even people within my own family, they chose not to as well. And I couldn't really say or do anything. But I think what really did have an impact was when I had my vaccine, I told my family, some of my family members then kind of proceeded to have the vaccine as well. So, just by me having the vaccine, and a large number of my family members went ahead, including my mother as well. So, she was concerned just like anybody else. And she had heard all the stories from her friends, from the neighbors and everyone else, this will happen, that will happen, and so on. So, I tried to reassure her as much as possible. And she's had both of her vaccines now, and she's fine, So I would urge anybody to kind of, do some research if you need to, but go and have the vaccine done. Encourage. There are so many ways of getting the vaccine, and it's not difficult. It's so easy to get an appointment and just go and get your vaccine done.
Yeah, and I think that was a really good point that you mentioned there. Do your research, but ensure that the platforms that you do use, they are genuine platforms, and then they're not of conspiracy theories. And if you really want to speak to somebody, go speak to your doctor about it, speak to the nurse about it, speak to somebody who really knows and has the knowledge about this vaccine and the importance of it. So please do talk to the right people. I would love to hear your views on this, and whether you've had the vaccine, whether you haven't had the vaccine, because I know there's a question on here which I will be asking Dr. Masood when he comes back, about how do you encourage a younger person to have the vaccine who believe that they're fit and healthy, or they may not need it. How do you encourage them?
Because the younger generation, obviously, they think that they are fit and healthy and they don't really need the vaccine. But you do need the vaccine to protect yourself.
Yeah, I can see somebody with their little hand up, and it's the amazing Jax Mackenzie, who I believe I funded a project to actually raise the. I might be wrong, because I do so many funding applications, to raise the awareness of the importance of vaccination in his community, which I believe were French speaking, but I might be wrong because I am saying it on the top of my head. Am I right? Please
you are right. Yeah. Yeah, just I wanted to give my experience about the COVID. So I've been working from home, and children have been around. So it has been really a very difficult time for me to combine working and then coping with children. But the most important thing for me was how I'm myself involved in motivating, encouraging other people, especially from the Black French African community, to come forward for the vaccine. So back in April, the NHS should come in the community to vaccinate people, and they wanted at least 20 people from that setting, and we were ourselves involved, and the target was hit. We had more than 20 people coming forward for that vaccination session, and 7 people came from our community. So on another occasion, I had a discussion between someone who wanted to get the vaccine and another person who was trying to convince him not to take the vaccine. So we spent almost half an hour discussing about that and see who was right or who was not right. At the end of the day, after 1 month, I met the person who wanted to get the vaccination, and the person told me that, look, regardless of what you were, arguing with the other person, but I called one of my friends who is a GP, and he explained to me everything, and I've got my vaccine. That was really very, very good to hear from him. And I've been receiving phone calls from older people to explain to them, because of the language barrier, what can come, what the pros, the cons of the vaccination. And I always try to relay the same information I got from the NHS, from health professionals, because we invited many health professionals to come and speak to people, to answer to their question the way we are doing it. And we are carrying on try to raise awareness, especially with the Delta variant, try awareness. That's the reason why I asked the question about the children, because this happened at the beginning of this week, that on Monday we received a message from school that the younger one in nursery should not turn up to school because one of their mates was tested positive. And the same day on Monday, we received a phone call that you have to collect your daughter who is in year 1 because one of their mates has been tested positive. So this really, it's becoming worrying. So this is what we really need to tell people, that even though the lockdown will be lifted up, but we are not safe. And the only way, and I was explaining to another person, I was watching news back home, and the situation back home in the Democratic Republic of Congo is not worse than here. But the leader of the panel of the COVID-19 said that the only way to eradicate this pandemic is to take the vaccine. You see, so if there were not a huge proportion of population is concerned by the disease, they are really insisting about receiving the vaccine. But here, for example, today, from the statistic, it's nearly yesterday, it was nearly 42,000 people who were tested positive. So it's really worrying. So meaning that we really need to push for the vaccination process, and for people to understand that it's really important for people to get a vaccine and vaccinated, and protect themselves, to protect their families, protect the community and the natures as well.
Thank you very much for that contribution. That was great, and thank you so much for joining us, because it was lovely to hear about your vaccination rollout and how you encourage members of your community to take the vaccine.
And I've got my first dose, waiting forward for my second one.
Oh, that's great.
So
well done to you.
many people, when I do speak to them, I say that have you got your have you got vaccinated? I said, yeah, myself, I've got vaccinated. I've got my card. You can see it. So I don't speak just telling you things, but what I've experienced myself. So this is what I'm telling people. Thank you.
Thank you very much.
And Jax, you made some two valuable points there as well. I think one of them was to actually take the vaccine, because the vaccine is going to save your life. That was very, very good. And then secondly, I think, if you are going to do any research, make around the vaccine itself, make sure it's from a trusted source as well, either your GP, from the NHS website, or any other trusted. That is really, really crucial to make sure you get your answer from a trusted and reliable source. I also want to just say, because we've got someone within the audience, Jennifer Pearson. I don't know if she wants to come on and say a few words. Jennifer's been involved with a large number of the vaccine. She's the chief leading nurse around the vaccine program as well. And she's done a huge amount of work. And we are currently doing some work with her as well. And she's made huge contributions as well in terms of what she does, especially for the Black African Caribbean community as well. And I really haven't got words to say as to, but I was wondering if, Jennifer, if you are in the audience, if you can come and say a few words as to your experience and your journey as well.
Thank you so much, Mohammed. I'm afraid my camera isn't working.
That's
I'm
fine.
on a different device, but it's wonderful to be here. Thank you for your kind words. I am not the only nurse. I am one of a number of lead nurses working for the BSOL CCG, but I cross over to Sandwell. As you know, I go wherever I'm needed. So I am an Afro-Caribbean senior nurse. I have lots of personal experience in as much as I have people in my family as young as 30 who are refusing to have the vaccine, and they're telling me that they're fit and they're well. They're telling me that their family members and friends have caught COVID and it's been mild, and they're more frightened of the vaccine rather than COVID itself. So for the past few months, I've spent a lot of time trying to educate, and they know I have worked in intensive care. That's my background. They know I've cared for people who have passed, who have suffered with the symptoms. They also know the advocacy work that I do, not just for the Black and African community, it is for every community, but I know that there are disproportionate death numbers in my community. I also know that there are more concerns in the Bangladeshi and Afro-Caribbean communities. And I have spent a lot of time doing webinars, trying to answer people's questions, be as transparent as I can. You know, that this vaccine isn't without risks, as the doctor said earlier, but they're so rare. They are so rare. And the minute we find out if there is an issue, like we did with the AstraZeneca, we now don't vaccinate anybody under 40 with AstraZeneca. And with respect to vaccinating children, we at the moment are only vaccinating 18 and over, but if somebody is between 16 and 17 and has underlying conditions, we do vaccinate those individuals. I have had my vaccine. I had the same concerns as everybody else, but because I have seen the disproportionate effects on my colleagues, on my friends, I took the vaccine. I've had both doses and I was absolutely fine, apart from a little pain in my arm at the injection site. I was fine, and I would advocate having the vaccine, because if we look at hospital numbers and admissions, they are going down. We are not like we were 12 months ago, where, you know, I was writing letters to my children to say, you know, I love you very much, and if anything happens to me, because I was caring for people in a hospital with COVID all around me, and I didn't know whether or not I was going to be infected. I'm now in a different place. I feel hopeful. I feel that we should look to the future, but I also fear for a lot of people who have not had the vaccine. I really, really do, because long COVID seems to be affecting all ages. I don't want to take up too much time, because I think it's really important to hear from everybody. You're doing sterling work in your communities, near Neighbours, transforming communities. You're doing fantastic work. And, you know, I've learned from you. I've spent a lot of time speaking to faith leaders, because faith means an awful lot to people. Healthcare workers, staff have told me that faith has meant a lot to them. So I thought it was important to engage with faith leaders and community groups, voluntary groups, and have spent a lot of time with these individuals who are trusted messengers in the community. And I think, you know, Mohammed will tell you, I met with all, well, not all, but quite a lot of the faith leaders from all of the surge areas: Blackpool, Wirral, East Cheshire, Leicester, Manchester. Met with them all very, very recently, and we talked about the work that we're doing in terms of raising confidence and reassuring people to have the vaccine. And we look to you to spread those positive messages, and just be honest about some of the risks as well. Just that risk-benefit discussion is really important. So thank you very much for giving me the time to speak.
It's a really pleasure to have you here, Jennifer, and it's always a pleasure to kind of listen to you and your background. Obviously, you spend a lot of time, I know, within, not just within the Black country, but right across the country, to be fair, with the work that you are doing as well, and it's greatly appreciated. So thank you, and thank you for everything that you are doing and you're part of. So really getting back to the kind of discussion. So I don't know if there's anyone else within here who wants to share their story or their journey with us.
I can say a little bit about my own experience. Hi Shaz, hi Yasin. So I think in the really early stages of hearing about the vaccinations, as have been said by others, there's been a lot of vaccine hesitancy. So I was really keen as a Christian minister to really to be able to say to my congregation, not to tell them what to do, to encourage them to have the conversations with their GPs, with people who were informed, rather than relying on information that they were getting via WhatsApp or via social media. And it was really interesting, some of the responses that I got once I started talking about, the fact that I was going to get the vaccine when it became available. And some people were adamant that they wouldn't have it. I had long discussions actually with my mother-in-law. That's what I posted in the chat, who was very reluctant because a lot of the information that she'd heard from her peers. And then after, similar webinars like this, listening to people like yourselves that I encouraged her to log on to, we sat down together, listened to the evidence from professionals. She decided that she would go and get the vaccine. I think I took her for her first dose either December or January. And lo and behold, what she started to hear after she'd been vaccinated, a lot of the people who were telling her they were adamant, they shouldn't get it and this and that should happen. And well, they were starting to get it as well and get vaccinated themselves. So I think, forums like this are really important. But I do take the point that Jennifer was making. It feels as if we've reached a point now with a lot of the 18 pluses who are eligible for the vaccinations that it's perhaps going to take further work on all of our parts to encourage them with credible evidence, because I think there are a whole range of issues why people aren't taking up the vaccines. And sadly I do fear for those who haven't had it either, based on what we're hearing about this new variant. But yeah, certainly really appreciate all the work that colleagues are doing.
Thank you very much, Cassius. That was a great input to the discussion. Thank you very much for that. I'd like to remind everybody that next week we are having another session. It's focused on mental health and well-being. And if you want to join Cassius, I'll be really grateful if you can put the link onto the chat for people to go straight onto the Eventbrite and to see whether they would like to also be participate in that as well. We have fantastic speakers lined up for that event. We've got Dr. Bawan and also Sister Rachel Moore, who is the mental health development worker for Transforming Communities Together. As a young person, what are your thoughts on the vaccine?
I'm hesitant as of now. I don't think I'm going to proceed at this stage. I haven't been invited yet anyway. I'm 19.
Yeah, why do you have the hesitancy? Why do you feel so hesitant about it? What is it that, have you heard something? What is it that you feel like that I wouldn't take this vaccine?
I just don't know much about it yet, so I'm going to see what happens.
So you are in the right place then, because we will have Dr. Masood. I am going to ask you the same question at the end of this session to see whether you've changed your mind on that. So thank you for joining us. It's great to have you amongst us.
But obviously, the work you're involved with as well, in other parts, in other areas as well, is the hesitancy level still the same, or is it variable, or is it increasing? I mean, how does it vary from area to area?
Okay, so what we do know is that we don't like to use the word hesitancy, because a lot of people have legitimate concerns. They really do. So we don't use that term. With all the work that you're doing, we're doing in the NHS, in the CCGs, etc., the increase in uptake there is an increase. When I started doing this work, 72% of our people were unlikely to have the vaccine, and that's gone down to 50s now. So we're not where we want it to be. We still have 131,000 NHS staff members across the country who haven't had the vaccine, and 54% of those are ethnic minority staff. So it's the community, and we often say the community is the staff, because what staff are bringing home in terms of what they say is really important. So the staff are the community and the community are the staff. So we're still working on staff. You know, have been with the mobile van all over Birmingham. We're in Cannon Hill on Sunday from 11 till 6. We were at the Afro-Caribbean Centre last week. We were there all day, and we vaccinated 101 people who were just walking past. They just didn't have the information. They said things like, I think I might have clots, so I can't have the vaccine. Yes, you can. I'm pregnant, I can't have the vaccine. Yes, you can. I'm breastfeeding, I can't have the vaccine. So we still need to give the information, although we think people must know this by now, because we've been talking about it constantly, but actually the education is still needed. But to answer your question, we are, between us, reducing the numbers in terms of people not having the vaccine and increasing the numbers of those who are having the vaccine.
Thank you for that. And one thing you've just mentioned, obviously, you say you've been vaccinating people, just passers-by. And that's really good to know. And I think that is one of the concerns as well, which a lot of people have, is, you know, if you are picking on passers-by, if someone wants to get vaccinated, they haven't got any ID as such to prove themselves or anything like that, any form of ID, can they still get vaccinated, or do they need to have some sort of proof?
It's a big issue for me personally, because, you know, I'm Windrush generation. My parents were Windrush generation. So a lot of people that I know don't have authority to be in this country, even though they've worked in this country all their lives. We all know the scandal with Windrush. So there are a lot of people that the Home Office have said can have the vaccine, even though they don't have NHS numbers, they don't have ID. So not having that information is not a barrier. We can alter things in the patient outcomes data. We can put words like unknown. So if they don't have their NHS number, we can put unknown. Ideally, it's best to be registered with a GP so that we can follow you up and invite you back for your second vaccine, and we can give you information to improve your health. But there are no barriers to having the vaccine. It would be useful to have some information, but if you remember, we're vaccinating refugees, homeless, everybody. So not everybody's going to have all of those boxes that you and I tick.
Thank you. That's really useful, right? Good to know as well. So that's good. Thank you.
Somebody has been double vaccinated, and they've had a test to say that they have got the virus, and they can't understand why, because they've taken loads and loads of precautions. And it's just to remind everybody that the vaccines are not a cure. We don't have a cure, but what it does quite clearly is that it prevents you from having the symptoms. It minimises the symptoms. It stops you from dying. Hopefully it stops you from getting long COVID. So it does mean that you have COVID now, but according to this person's question, they're well. So yes, they can still transmit and they're self-isolating, so that's great. But the fact that they've had the vaccine, it honestly means that, you know, they are not suffering. So self-isolate and get back on the wagon, as it were.
I work in a local secondary school, and we are finding there is a lack of awareness about the vaccine, and majority of our students would not opt to have the vaccine should it become available. Unfortunately, this has coincided with existing vaccinations, e.g. HPV, DTP, and we have seen a decline in parent consent for these two. Are there any resources, support for schools to support discussions with our students? That's a really good question. I mean, is there any support?
Yeah, there's a young person's forum in the Department of Health. What I will do, Shaz, I'll share that with you, because they've made some fantastic videos for young people who they want to explain the virus to, but also they've aimed videos at sort of 16 to 18-year-olds as well, and 18 plus. So I'll share that. There is definitely lots of information aimed at the younger cohort.
Taylor, if you can give me your contact details, that would be great, so I can pass that information on to you. There's also another question that I found really interesting. I think you've answered that.
Because it is scary. I mean, I've got a 16-year-old. You know, it is scary. You know, for them. You know, when my daughter had to, you know, she's in a bubble, and then you know somebody got COVID and they had to self-isolate. She had to homeschool. You know, it is difficult.
Yeah,
and it does raise anxiety. You know, she didn't want to go out again.
Yeah, definitely. And I think sometimes unfortunately, it takes people to realise the seriousness of it when they lose somebody so close. And then they'll go and have the vaccination. And it's so important that we get that message out there. I think most of the questions on here have been answered now. So thank you, Jennifer. Thank you very much for that.
Not just one here, we just come through an email as well. So again, all it is it possible to catch two variants at the same time? And are two jabs sufficient to protect you from two different variants?
We know that being double vaccinated means that the current variants out there, we are immune to. As Dr Masood said earlier, there are a variety of variants. There was the B, there was the Kent, South African, and now we've got the Delta. And we know that currently vaccines protect us against those. That doesn't mean that there might be further mutations. We don't know what. We're still learning. We don't know what's around the corner.
Okay, Dr. Masood is joining us now.
Jennifer Pearson has been very kind enough to answer some of the questions, Dr. Masood. So she's been quite helpful. But there are some questions, obviously, which are more technical.
There is one question here, Dr. Masood, that was quite interesting. What would you say to a young person, 25 to 30 years, who says they are fit, healthy, and do not need the vaccine, especially to someone who understands how the virus is transmitted, instead frequently bombarded with accounts, i.e. the presenter who died following a AstraZeneca vaccine? What would your advice be, and how do you engage with a person, a young person who believes they're fit and healthy and they are invincible, so to speak?
And I get that, you know, those of us that are a little bit older now, we know what it feels like when you're in your 20s, you know, you're fit and well, you feel invincible. But that's not how life works. And, you know, if we could predict who is vulnerable and who isn't, it would make our life easier, but we don't know. And that ultimately, that's the truth. We know that if you are over the age of 50, the risk is higher. We know that if you have other illnesses like diabetes or heart disease, we know that the risk is higher. We know that if you're a person of color, the risk is higher. We don't know the other factors. So we don't know why, if you go into hospital, there are 30-year-olds who are on ventilators, who are fit and well. We don't know why they succumbed to the illness. We just don't know. So anyone that says, I'm fit and well, you may be fit and well. My kids, they're all fit and well, but they've all been vaccinated, you know, and that includes my sons and my daughters, because again, one of the concerns is, well, what happens regarding, you know, pregnancy and stuff like that. And look, the only thing I can say is that I believe it in enough that I've done it for myself, my wife, my kids have done it, everyone I know, you know, my parents. Let's, you know, look at the evidence. And the evidence is that if you're young and you're fit, there is less risk, but there's no guarantee. In the same way, taking the vaccine provides protection, but it's not 100%. Now, the question is getting the vaccine, does it provide more protection than not having the vaccine and taking a risk of getting it and the symptoms that might follow? Well, actually, at the moment, there is still more benefit in taking the vaccine. And that's kind of where the discussion is. But I understand that. It is very difficult. It is worrying. But, you know, as we go into winter, not only are we going to have COVID, we're also going to have flu. And so there is that. The other thing is that, you know, we've spent a lot of time in isolation. Our own immunity is not as strong as it could be. Your immunity builds because of exposure, because of interactions. Many of you with young children will know that as soon as schools start in September, there are loads of runny noses and people get colds and so on, because they've not had that exposure. So there are many factors. But I would say, even if you're fit and young, really, and again, it goes back to this idea of protecting yourself, but also protecting those around you. Because as someone who's young, if you pick up the virus, you may not suffer much. But what happens if you give it to someone? What happens if you give it to a family member or an elderly friend or relative? Those are the risks, and those are what we're trying to stop.
That's great, Dr. Masood, thank you. So the next one is from BG, and they say, why does the rate of second jabs seem to have slowed down?
So really, this is about ensuring that we vaccinate as many as possible. So it's not that the rate of the second jabs has slowed down. It has, in the sense that we focused on the older generation first and the older cohorts, and we got first and second jabs done. Now we're moving to the younger cohorts. We're focusing on a much bigger population, but the first jabs. So that's the reason for the shift.
Yeah, and in all fairness, from my experience, my husband had his jab, first one, but then he was called 4 weeks earlier and given the option to take a second jab earlier. So I'm sure.
So originally we had a gap of 12 weeks.
Yeah.
We're now reducing that gap to 8 weeks.
Yeah. So yeah. That's
because
great.
We've got more supply, and we're getting faster in terms of doing everything that we're doing.
That's great. And the next question is from Jay. What proportion of the people that have been hospitalised or died in this third wave had both doses of the vaccine? Is there any difference? There's two questions here.
Yes.
Is there any difference between the figures for Pfizer and AstraZeneca?
So in terms of the difference between Pfizer and AstraZeneca, very little. We do know that actually, in terms of the protection, I think there's a very slight difference if you look at the big numbers. But actually, overall, if you get the vaccine, that's the biggest protection you can have. In terms of the number of deaths, what we're finding is that more of the people now who are coming into hospital and who are getting very sick are the ones who have been unvaccinated. I can't give you the exact numbers, but compared to before, if you have a double vaccination, it pretty much guarantees that you are not going to die. It's not 100%, but it is, it's as good as you can get, if you like. So there is a huge difference between being vaccinated and unvaccinated.
BG asked, is Delta Plus another name for the Lambda variant, or is it another variant altogether?
No, so Delta Plus is a variant of the Delta variant.
Okay.
And so actually the worrying thing is that it's a more aggressive variation. You have got the Epsilon variant, which comes from which originates in South California, and then you've got the Lambda variant, which originated from Peru in South America. Now, both of those, what happens with variants is when they develop and the mutation starts to spread, they are labeled as a variant of interest. And then if you're worried about it, it becomes a variant of concern. So the Epsilon and the Lambda have both been downgraded to a variant of interest, meaning that the transmission rates seem to be lower. Now, if the transmission rate is lower, then generally they stop spreading. So they might start to spread. But if you look at the UK, because we've got the Delta variant that is dominant, the chances are that and we have had cases, but those cases are unlikely to spread because it's the Delta which is more aggressive. But the Delta Plus is a variant of the Delta.
Right. Okay. Thank you. I didn't know that, so I learned something. I'm sure others here have learned something as well. Now, Katie Shinton asks, my daughter's school has had multiple cases. She is 5 years old, and this is the second time in a couple of months that she is in isolation. Sadly, her teacher has long COVID. Is there a delay with receiving PCR tests results back, as the school have not received the confirmation of the PCR test yet, and it has been 3 days. Tomorrow, so my daughter is in isolation from a positive lateral flow.
So there shouldn't be a delay. So normally, once you've had a PCR, most of the time you'll get the result the next day. If there is a delay, it might be for 2 days. I would say that if you've not had the PCR test back in 3 days, that it may have got lost, and therefore you might need to go and get it repeated. In terms of the isolation strategy. I think what we're looking at is as more people get vaccinated, the likelihood is when we go back to schools, it won't be the same policy where the whole class or the whole year gets sent home. I think there will be changes in that respect.
Okay, thank you. I'm just seeing if there's any more questions, because some of the questions Jennifer answered quite eloquently, so I won't repeat those.
Dr. Masood, is it possible to catch two variants at the same time? And I think this was a question is alluding to a story that was in the news as well a couple of weeks ago, where a woman from Belgium or France,
that's right.
She passed away. So is it possible?
There have been cases, but I think they are very rare. So look, in reality, once you've been vaccinated, you'll have protection, and that protection protects you against most variants. So it is very unusual. Again, I don't know the full detail other than it was an elderly patient who had two variants that were picked up. Again, I don't know why. The other thing is that it depends on the testing. So what we don't know is whether that was picked up from a PCR and therefore it was active infection, or whether it had been picked up from a nasal swab where, or a lateral flow where, there are various ways of interpreting it. It's not something that I would necessarily be concerned about.
Jennifer is asking a really good question here. Can I ask if the Indian Covishield vaccine is compatible with AstraZeneca? Is it best to give Pfizer after Covishield, or does it not matter?
So at the moment, there are research studies going on to understand if you use two different vaccines, whether you get the same protection. Now, generally, because of the way vaccines work, theoretically, it is okay to give two different vaccines, because ultimately the vaccine is not the one giving you the protection. The vaccine stimulates the body to create its own white cells that will provide the protection. So if you think about it, you're really stimulating that response. So if you stimulate the response with Pfizer and then you go with Covishield, it should give you that protection. What we don't know is, because they both work slightly differently, what's the overall protection? So there are studies going on, and I think, over the next few months, we'll start to get more information. And that will help guide us as well, because when we're going for the booster, it may be that you go for, you might have had Pfizer now, but you might go for AZ as a booster, or the other way around. You've had AZ, you might have Pfizer as a booster. And certainly, with people that had concerns or reactions to a first dose of AZ, we've switched them. We have, in those circumstances, given Pfizer if needed. So I think we're going to have to see how that develops, but I suspect we will be able to give mixed vaccines in the future.
Okay, I've got a final question here from Sister Balbi from Warsaw. She asks, there's so many things. This is unfortunately the final question that I'm going to ask. So once double vaccinated, people are switching off their TNT apps, also feeling that if they are pinged, they should be okay anyway. No need to isolate. Is there a major concern?
So I wouldn't say there's a major concern, but again, it goes back to this idea of caution. So once you're doubly vaccinated, one of the things is you might get very mild symptoms, which you ignore. Now, the problem is if you have got it and you don't realize, there is still a risk that you will give it to someone else. And I think part of the reason for test and trace is that if you develop COVID, but you've been to, say, a restaurant the day before you even realized, well, actually, it's important for others to realize that they may have been in contact with you. So it's not just about you getting infection, but it's also about who you may have transmitted to, even if you've been doubly vaccinated. Now, I know that the rules are going to change in terms of self-isolation. And I think part of that is really because we're finding that once you're doubly vaccinated, the risks go down in terms of not just developing illness, but also the risk of transmitting. And I think as the risk goes down, it will become easier. What I would say is not to switch it off yet, but I think we'll get a good idea of what's going to happen over the next month. Once the 19th passes, we'll see what happens with rates. We'll see how the country responds. I think once the rates start going down, then I think we will get advice about what to do with test and trace. At the moment, my advice would be keep it on, because again, it's better to be safe than sorry.
Thank you so much, Dr. Masood. That was the final question. Unfortunately, time is ticking on. I am going to hand over to Mohammed Yasin to wrap up.
Thank you, Shaz. And I just really want to say thank you to everyone for being here this evening and taking time out to be with us. And a big thank you to Dr. Masood for taking time out to join us and help with the questions as well. And I know he's been really, really busy, obviously, with the work he does as well. So we really appreciate your time, Dr. Masood, as always, and really appreciate your input into this as well, and kind of highlighting and answering some of the questions that you have with regards to this new Delta variant and the way forward from here. So really, really appreciate your help. Thank you. And really thank you to everyone else as well on this webinar who has joined us today, this evening, for being here. I hope that it has kind of answered some of the questions, some of the concerns that you've had. I know we've kind of run out of time, and hopefully we can kind of pick up, going forward. We're hoping to kind of continue with this sort of work, with these webinars, especially as we go after the summer and then into the winter period as well, where we know this is going to pick up pace. So there'll be an even greater need to kind of keep up to date with the new information, new variants, and how to kind of keep ourselves protected. Well, like Dr. Masood and Jennifer said as well, the best way to protect ourselves is by taking the vaccine. That is the only way that's going to help us protect ourselves and also people around us as well. So I really just want to say thank you for being here this evening. Really, really thank you. And hopefully we will see you again soon in the upcoming webinars as well. So do join us. I'll hand you back to Shaz now.
Yeah, I can only reiterate what you've just said, Yasin. A big thank you to all our participants, Dr. Masood and also Jennifer for chipping in the last moment as well. So thank you very much. And if anybody doesn't know anything about Neighbours, please do go onto our website. We do have, as I mentioned earlier, when Jack gave his contribution on some of the funding that we funded him, our funding applications will be reopening. So if you want some more information, I will leave my details on the chat for you. Thank you very much for joining, and please do look out for any further webinars that we'll be delivering. And like I mentioned earlier, we do have another one, again in partnership with the lovely Mohammed Yasin and his equality and diversity team, which will be focused on our mental health and well-being, how we look after ourselves and how we support others. So if you can join us, please do. And a final thank you to you. Yeah.
Thank you.
Thank you.